Hi, you guys, and welcome to the channel. My name is London. I am a labor and delivery nurse and have been for many years. I have assisted in over 100 deliveries and have helped women from lower economic status to higher economic status, women who have done C-sections, high birth deliveries, women who have gone unmedicated. So I have a realm of knowledge when it comes to labor and delivery, and also the postpartum phase and also the antepartum phase. And I am here to help you guys make informed decisions, and that is what this channel is for. It is to help educate you guys so that you feel empowered and inspired to make your own decisions when it comes to your healthcare, or partner with your healthcare professionals so that you guys can come up with a plan of care for you that best fits you. I am in no way giving any advice on this channel. I want you to really take the information, learn from the information, but really come up with a plan of care with your particular healthcare professional. So please understand that this channel is not giving any advice to anyone. It is simply my knowledge, what I have gained, and I am sharing that with you to hopefully educate you in some way so that you can make better decisions for yourself. So without further ado, today we are going to be talking about, if you are going to be scheduled for an induction, the things that I would ask. The number one question I would ask is, why am I being induced? Why am I being induced? Am I being induced just because you want to deliver me before you go on vacation? What is the reason for me being induced? And is this reason a medical indication for me to be induced? That is the first question that I would ask. It's a loaded question. So that's the first question I would ask if I were going to be induced. Again, these are things that I would do. I am in no way trying to tell you that this is what you should do. But if I were pregnant today and I were going to be induced, the first question that I would ask my healthcare provider is, why am I being induced? And is there a medical reason for me to be induced? The next question that I would ask my healthcare provider is, what medication do you plan on starting me with the induction process? And will, someone check my cervix prior to giving me that induction agent? It's important to check your cervix beforehand because you really want to know where you are. Where is your cervix? Is it soft? Is it not? Is it closed? Like where are you, And then I would ask, based on my cervical exam, will you be giving me something to help my cervix thin out? So if I'm closed, if I'm 1 and I'm thick, if I am 2 centimeters, but my cervix is still very thick, will you be giving me something that can really help thin my cervix before something, let's say like a cervical ripening balloon or Pitocin? What is your process when it comes to medications? Like, do you start with prostaglandins, which prostaglandins are the medications we talked about, misoprostol and Cervidil. Those are the medications that help thin your cervix. And that is really what we want to do in the beginning of an induction. We want to thin your cervix because that is what early labor does. It's responsible for thinning your cervix so that it can dilate beautifully. And you also do dilate in early labor. You have to get from 0 to 5 centimeters. That is considered early labor. But in order to do that, you need to be very nice and thin. So that is one of the things that I would ask about. Are you going to be giving me medications that is going to help thin my cervix based on my cervical dilation, especially if I'm anywhere between 0 and 2 centimeters? The next thing, and it is my first baby. That's also something that's very important to note. Second-time mamas and first-time mamas are very different. This video in particular is more geared to first-time mamas, because second-time mamas, it's different. Your cervix is very different than a first-time mama cervix. You know that the time it takes to deliver is very different as well. And we can go into the differences between first pregnancies and second pregnancies and what are those differences that you may experience. Again, leave it in the comments below if that's something that you want to see. Then the next thing that I would be asking is what is their C-section rate? You do want to know what their C-section rate is, particularly your provider. It's a good question to ask. What is their tolerance when it comes to labor? What is their C-section rate? What is the hospital C-section rate? And what is their personal rate? Because doctors get their own personal rate and hospitals also get their own rate. And it is not an abnormal question to ask. It is actually a conversation that I think should be had prior to the bedside, so that you can have the conversation under very calm circumstances. In the event of a C-section, what does that look like for me? What is the process that you go through? What kind of incisions do you do? All of those different things. Those are other questions that I would ask when it comes to your healthcare provider if I were being induced. Oh, I almost forgot. There's one more question that I would ask. Actually, it's kind of like a twofer. I would also ask whatever medication we're going to start me on with my induction. Is there a way that I can be on intermittent monitoring so that I can move around? And also, will I be able to eat? That is another question that I would ask if I were going to be induced today. So that is all of my questions. I really hope that you guys learned something from this video. I know that it was a lot of information, and if this is all foreign to you, it can be very confusing. If you do have questions, please leave it down in the comments below. I hope that I can help you with any of the questions that you have, but definitely subscribe. I have created this channel to really bridge the gap between patients being misinformed and patients who are informed incorrectly and, make decisions based on incorrect information. I'm really trying to bridge that gap and help mamas and patients to understand that the healthcare system is there to help you when you need it, but also your body does amazing things. And if you have the education, then you'll be able to advocate for yourself within the healthcare system so that you don't feel intimidated, so that you don't feel overwhelmed, and so that you don't feel like you have to refuse everything because you just don't know. I'm really trying to bridge that gap so you can make informed decisions, you can make educated decisions, and you can really do what is the best thing for you and your baby and your family. So if that is something that you are interested in, definitely do not forget to subscribe and also like this video so that it goes out to more mamas, because I'm telling you, there's so many gems in this video that I really, really want so many women, especially first-time mamas who have never experienced pregnancy and labor, to know prior to going into the hospital. So until next time, I will see you guys in my next video. And yeah, love you, wishing you the best, the most safe, and the most wonderful delivery. Understand that this is a journey and just enjoy the journey. Bye.